So in radiology, if I say anatomic markers, what do I mean by the word anatomic markers? So anatomic markers is just simply what? A particular place on the body. That's like, if I do an imaging now, probably this imaging is just showing this part and not the whole hand. So how am I able to know that, okay, first of all, this place is hand, and how am I able to locate that part of the hand? So of course it has to do with good quality knowledge of your anatomy, you know. So they are just markers, they are things that when I see, then I can now be say, okay, this imaging is actually belonging to this part of the body. So they are just essential tools. They are used by radiographers to be able to now identify and label images, you know. So this will ensure that everything is accurate, ensure that everything is safe, ensure that any imaging coming up, there's proper interpretation. So types of anatomic markers, we have the right and left markers. So this one usually indicates if the imaging you are holding is a right or left. Okay, so I think the issue of anatomic markers is not something that we can finish here with. This is just introduction. So when we're now talking about the different types of imagings, I think we'll now be going in depth on it, you know. So it actually prevents misinterpretation of the anatomy, you know. It must be placed before exposure, okay, to become part of the radiography. Then we have the oblique markers. This one are used when the patient is positioned in an oblique angle. So it helps the radiologist to actually understand the exact position during the examination. Then we have the decubitus markers. This one indicates when the patient is lying down, you know. It's very important in all those chest x-rays, abdominal x-rays. Then we have the time markers. Those ones, they record the time of exposures, especially in dynamic studies. Then other markers include all those pregnancy. If somebody is pregnant, how am I able to know? You know, post-operative markers. Okay, how am I able to know that you know, they did surgeries for this patient? And also weight-bearing markers. That's when the patient is standing or when the patient is bearing weight. Okay, so this is what we got for what is anatomic markers. So what are the importance of anatomic markers? They are very important because they help in documentation. So they make the documentation to be very much more, you know, how will I put it, to be very much more solid, you know. It helps you to actually diagnose properly, you know, and it's a professional standard, you know, so it's part of a radiographer's work. Okay, so this is what actually differentiates a radiographer and other people in the society. So a radiographer is able to hold an imaging and interpret rightly, you know, and that's it. Okay, also patient safety.